All right, Doc, I think we're live.
All
And
right.
yep. And I'm experimenting today. I'm streaming from two different pages. So let's hope it all works. Well, Doc, it's for me, it's definitely my pleasure to have you here because when I'm saying doc, you're actually my doctor, my integrative oncologist. And I've been looking forward to this moment because we have a ton of questions to ask you. And I feel like I'm getting a free session. So
And you could say I was your doctor. I couldn't say you were my patient. So good for you.
that's true. So, Doc, first of all, tell us a little bit about your background.
Sure. So I am probably that last wave of family physicians who started out in a small town and did everything from delivering babies to hospital work to kids in the office to everything. And um, from that, through my own experience, which we'll talk about, I've kind of progressed into integrative medicine and integrative oncology.
Okay, and you have a very impressive background. You want to touch a little bit on that? I know I met you at Atrium. Um,
Right.
so, give us a little bit about your background.
So I've completed a fellowship in integrative medicine with Dr. Andrew Weil at University of Arizona. I'm also fellowship trained in family medicine, board certified. Back in the day, I was also fellowship trained in obstetrics. And going through, I think probably my best criteria for the work I do now is that I'm a 20-year breast cancer survivor. And
Yes.
so nobody knows what it's like to hear that word. And that gives me a very unique perspective when I work with my patients.
I remember when you shared that with me. That's what gave me the confidence because when I was referred to your office, my breast surgeon said, "Look, I'm going to set you up. I'm going to set those were the words. I'm going to set you up with some really cool people." And of course, again, in the early stages of hearing the cancer diagnosis and talking to surgeons and oncologists and radiologists, you're just so overwhelmed, right? But she said, "I'm going to give you someone that's going to really help you. I'm going to give you this team." They're called integrative oncologists. And she said, and green tea is going to be your new best friend. I'm like, okay, what does that mean? She says, you're going to become friends with green tea, and they'll tell you more about it. And I remember when we first met and you told me you were a survivor, I felt like, okay, this is going to be more credible for me because this person will be telling me from the perspective of someone who's walked in the shoe and what works, what doesn't work, So I would, so that it's unfortunate it happened to you, but it certainly endeared you to your patients. It
It,
did for me.
it changed the course of my career. Like I said, unless you've walked that walk, unless you've heard that word, you've had chemotherapy, you've had radiation therapy, had endocrine therapy, you don't know what it's like. And,
Mhm.
cancer's unique. I always say that most times in life, you feel bad, you go to the doctor, they do something to make you feel better. For cancer, the treatment we get often makes us feel worse than when the whole thing started. And as scary as diagnosis is, sometimes the end of treatment's even harder. I
Yeah.
didn't know I had this. Is it going to come back? Will I know? And can I do anything to keep it from coming back? And so that's
Right.
the kind of unique role I get to play with my patients.
Yeah, and you said that it was your own cancer journey that started you down the path of integrative medicine. How did that come to be? How did that happen? What happened?
Well, the same as any other patient. When I got through with my treatment, I'm like, I don't want to go through that again. And I started educating myself on nutrition. And as physicians, we don't have good training in nutrition and in integrative medicine. So it led me to do that fellowship and in a 2-year fellowship in integrative medicine and totally changed my practice, the way I did primary care. And then the opportunity opened for me to come to Charlotte, North Carolina in 2013 and start their integrative oncology program.
Awesome. All right. So, can you explain the concept of integrative oncology and how it complements conventional cancer treatments? And this is a really important question because there are patients who I know who just want to go to integrative work.
Right.
They don't want to go the conventional. So, how do you get that to come? Because you're working with oncologists. So,
Exactly.
how does it complementary medicine? So,
And
how?
I'm a
Yeah.
very much a team with the oncologist. I say we are not alternative. We are integrative. I know what their oncologist is doing. The oncologist knows what I'm doing. We're working together. I try to make it very patient centered, directly for that patient themselves, not any other patient. We're
Mm-hmm.
looking at as much evidence-informed information as we have. We also want to make sure that we're not doing anything that's going to interfere with the treatment. I don't want to do something that makes their treatment more toxic or less effective. So that's where that partnership comes in. And I'm looking at mind body, I'm looking at natural supplements, I'm looking at lifestyle modifications. And, I want to empower the patient, because when you hear that diagnosis, you feel like you get thrown into a hurricane. Things are happening fast. I want to give as much control back to that patient as I can. So that's a wordy explanation. The simpler one to say is, I'm here to load the boat with everything possible to help that person get through treatment without sinking the boat. Meaning
Yeah.
there's a lot of misinformation on the internet. There's always somebody trying to sell them something. Suddenly all their family and friends are telling them what they should do or shouldn't do. So that's my job, is to load the boat and make a plan specifically for them.
What are some of the typical questions your patients ask you? Because I know that in the beginning, I was asking, can I drink this? Can I drink that? Can I take this herb? As a Jamaican, and especially people of the Caribbean descent, we have our own herbal medicine. And so I think it was your team that pointed me to the Memorial Sloan about
Right. The
herbs,
website. Right.
which was good. So now I don't bother you guys as much. I go there. But, what are some of the typical questions you hear in your practice?
Well, and some of that comes back to control. You want to know what you can do to help yourself either deal with the side effects or decrease that risk of recurrence.
Mm-hmm.
So a lot of times patients are sent to me for side effects or symptoms. I'm helping them with that. A lot of times I'm helping them recover from that treatment. And I'm really trying to rebuild them physically and emotionally from going through that. How do we rebuild you for having gone through this experience? I think we can become stronger for having been through it, but we've got to give you the good tools to do that.
Yeah. Yes. I remember one point I was asked, because I know you work with another doctor as well. So sometimes I would see you, sometimes I would see her. And one of the things I remember her saying to me was, or one of you all saying to me was, sometimes patient gets into this PTSD mode after they're done with radiation and chemotherapy, because now they're no longer going through treatment. They're now after treatment, and they're now worried about it coming back. And that part of what your practice did was to actually talk them through that process as well. Is that part of integrative?
Yes, because when you're in treatment, something's being done against that cancer. And that's where that end of treatment's almost more stressful, because like I knew I was doing something in treatment. Now what are we doing?
Mm-hmm.
And giving you the evidence-informed tools to know that we are doing something. There was a great analogy I heard one time that said the cancer was like getting mold in a basement. So you go in, you get the mold cut out. You might get the basement radiated, or you might get chemicals put on the basement. But after that's done, if you don't change the basement, the mold's going to come back. So we're here to do a basement plan to help change that so you're in a new place.
Yeah. Yeah. Okay. What role does nutrition play in integrative oncology, and how can dietary changes support cancer treatment and overall well-being? Because that's when people hear integrative, that's what you're thinking, diet, right?
Right. It is a huge part. We know nutrition's a big part of our health. That's the one thing when many people are diagnosed, suddenly they're on this juice fast or this extreme limitation diet. They just, because they want to do something. And so we try to guide them through, during chemo, how do you handle some of the taste changes? How do you handle some of the weight changes? How do we get you through that? And then afterwards, how are we getting you on a healthy diet to either get a proper body weight, or to help you just really maximize your health? Because if you look at long-term breast cancer survivors, they're dying from a cardiovascular disease or something else. Why do we want to get you through cancer and then not address your overall health? So nutrition's a very important part of it. We don't believe in any extreme diet. Oftentimes I'll have a patient that has gotten so restrictive, and it's like, nutrition and diet's a very social aspect of our life and our health. We don't want it so restricted that it's not enjoyable.
Right.
And we usually promote a plant-based, whole food, Mediterranean type diet.
You said something that I know there's someone that I know that's going through breast cancer right now, and you saying, as I said, when you get a diagnosis, you're not that juice fast, everything is green, you're not eating.
Right.
First of all, you're also worrying, and you're not eating, and you're trying to clean your body and all these things, and it's hard to maintain balance, right? Because all of a sudden meat is now your enemy. everything is your enemy, and so you have this fear. And
Exactly.
honestly, what is the truth about stuff like that? Maybe you don't have all the answers to that, but what is the truth? Because it's a constant thing, and you don't want to feel like you're doing something to give you cancer.
Exactly. Once again, it's back to that control. And the other thing, I'll get to the nutrition question, is that no one tells you that often young women going through breast cancer treatment gain weight.
Hmm.
And so then we're dealing with someone who's gained all this weight, which is a risk factor at treatment. We have to address with that. Um, and so nutrition. The thing about nutrition, it seems like a new diet comes out every day or every month.
Hmm.
And so that's where we have to get back to the real food. We
Yeah.
know that as Americans, we have way too much sugar in our diet. People say, well, does sugar cause cancer? I said, well, there's not a direct line, but we know if someone's eating too much processed foods, too much sugar, they're typically going to be overweight. They're going to have high glucose levels. The body then produces high insulin levels. Then it produces high insulin growth. It's just gasoline on a fire.
Right.
And
Right.
so we just got to help clean up some of that. And it's amazing when you help somebody clean up their diet, how much better they feel.
Yeah, that is true. That is true. That was a good side effect. But you're right, and I'm glad you mentioned that. Sugar, there's no, because I've heard this. There's no direct link,
Right.
but sugar leads to other things that leads to
Exactly.
other things.
Exactly.
Sarah, who's my boss, I was telling you about, and my partner in crime on this show, she's asking, what about pain during cancer?
Well, certainly that is one of the biggest, either fear of pain or actually having pain from the cancer from the treatment. So in integrative, we have a lot of different modalities that we will treat that pain that doesn't involve another medication, prescription medication. So for instance, I have a lot of patients who come with that neuropathy, with that numbness, tingling, pain in their fingers or toes from chemo. We've got some good research that acupuncture can help with that. A lot of breast cancer survivors are put on these anti-estrogen therapies that cause a lot of joint pain. We have some good studies that acupuncture can help with that. We've got some studies looking at healing touch or Reiki and massage for pain. So a lot of different things that kind of help with that pain that does not involve a medication.
I'm going to mention some of these pills that we have to take afterwards, right? And the side effects, which for some folks they're choosing not to go on into like a tamoxifen or whatever, an anastrozole because of the issues with bones and I don't know if you have an opinion on that. What like do you think? And again, I don't want to put you on the spot for anything that you don't want to you're not comfortable with, but do you think after surgery, radiation, maybe some chemotherapy, if you're opting not to do the adjuvant, the endocrine therapy, do you think that just the integrative, the diet and the nutrition and the this?
So that's it. So everybody's unique. Every patient's unique. Those
Mhm.
patients are sent to me. And first, the question is, why are you not choosing not to do that therapy? Is it because you're worried about the side effects? So what I found in my practice is women who are started on the anti-estrogens fall into one of three buckets. One,
Mhm.
they get on it and they actually do pretty well. They have minimal side effects. They do okay.
Mhm.
Two, they get in it and they have side effects that we might be able to treat with our integrative modalities, meaning acupuncture, certain supplements, or help with hot flashes to help them get through it and tolerate the treatment. Or there's a very small few that just get on it and just cannot tolerate it. It really affects their quality of life. Well, we don't know which bucket that person's going to fall into
Mhm. Mhm.
until they get on it and try it. And you can get on the medication and get switched or stop it, but to start out, if we know it's going to reduce your risk,
Right.
okay,
Right.
we don't know which bucket you're going to fall into. So it's still that person's decision if they have all the information, but I
Mhm.
always look at it that way and explain it that way.
I like that explanation because what you're saying then, look, there are some side effects. We all know that. And there's a small amount of people who really have some severe ones. But even the ones that are more mild, there is an integrative treatment, right? Whether it's, like it's acupuncture or something else that can manage that so that you can still get the benefit of the
Exactly.
addition. Okay.
So like,
Perfect.
for example, there was a great study that looked at vitamin D levels and this joint pain that comes from like an aromatase inhibitor. So the study said if we get your vitamin D level to a certain number, you're going to have less joint pain. So if we can get in there and start working on that before you start on that medication, you might get on it and tolerate it very well.
That was one of the first, that was the only time I actually came to your office is to get a vitamin D test done because
Mhm.
everything else was done like this, virtual. We did all
Right.
all meetings virtually, which was very convenient for me. but you did have me check my vitamin D levels. And because I was taking 10,000 milligrams during COVID, you guys told me to dial it back and go back to 5,000 because I was good enough. So which was good. And I did a bone density test after that, and that came back really good. Everything was pretty strong with that. So
and that's example of where we try to make things evidence informed. People know vitamin D is good, so they just start taking it. Like, well, we need to know what your level is first, because too low is not good, but too high is not good either. So we got to really tailor that and base it on evidence to help you with that.
Okay, there's some questions coming in, Doc. So I'm gonna get to some of those from the audience. A great point about cancer being different in each person from Peter. I wonder, is there any information about individualizing an integrative treatment plan based on, for example, genomic classifiers / genetic testing?
I really think that is the next wave of information coming, because genetic testing has progressed so far. Even as simple as they now can test somebody in terms of caffeine. Are you a fast metabolizer or a slow metabolizer of caffeine? Like for coffee. So like for coffee, I know I'm a very slow metabolizer. I can have a cup of coffee in the morning, still be going all day, where somebody else could take a cup of coffee, they're a fast metabolizer and go straight to sleep. So I think that is the next exciting field to really look at this very personalized treatment plan based on genetics and what modalities we have. I think that's a great question. I look forward to that coming down the road.
Okay. Sarah says, not to go too deep, but short answer. Thoughts on psychedelics for pain and anxiety?
So that is a field that is growing and getting a lot of research now. I think that's an area that's probably not ready for prime time, but I think that's something that's coming in the field too. I know some of the research has been done in some end-of-life processing with patients. But, from an integrative modality, I want to know what we can do without a medication first, or what can we do with meditation, cognitive restructuring? How can we exercise? How can we deal with some of these symptoms without another prescription or supplement?
That's right. This is a compliment, Doc. So what a blessing for those patients in Charlotte to have someone like you there. Every day you hear about another supplement to take or another food to eat or not eat. Are integrative oncologists the only ones who should answer those questions for a cancer patient?
I certainly think you want to have somebody that's trained in the supplements alongside of the oncology, because it's a different world. And like I've said, you always want to make sure you're not doing something that's going to make your treatment more toxic or less effective, or, interact with your medications.
All right. And then, of course, here's one from my other half here, Wayne. Any reasons why doctors traditionally have such little training in nutrition and preventive medicine?
Oh, I wish I knew, but I think it is getting better. I do think it is getting better. It's the same thing now. If you look at, maybe these are just my kids, but if you think of kids now don't know how to cook, haven't learned how to cook, how to do some of those culinary skills. There's even a push in medicine. Culinary medicine's a new field that's developing. How do we treat so many things with lifestyle, meaning nutrition? I'm going to a meeting in DC next month. It's going to have a big panel about nutrition and breast cancer. How do we address things with nutrition?
Yeah. So this is my time to this question. Can you discuss the use of herbal supplements or botanical therapies in integrative oncology, and what considerations should patients take into account when using them alongside conventional treatments? This is key because I know there are times when you guys have said, no, don't take that thing because it's going to affect this other thing.
Right.
Which is why it's so wise to check in with the doctors. But what are your thoughts on that?
Yeah, I'm very conservative with supplements during active chemotherapy, because I want that person to have the best outcome and I don't want to interfere with it. It's going to depend on what are their other conditions. Are they taking other medications? How is that supplement or herb metabolized in the body? Is it by the liver, by the kidneys? How is their other medication metabolized? There's always use the example of, people have heard there's certain blood pressure medicines that you don't want to take with grapefruit juice. It's grapefruit. So it's the same thing. We don't want to do anything that's going to interfere there. I think one of the simplest things that I do that seems to have the biggest impact on patients during chemotherapy is a probiotic. There's a certain quality probiotic that I've used, and patients come back and say, wow, that made the biggest difference on how I feel for some of these things. So there's a big role for that. We just have to be pretty cautious with that.
Yeah. Doc, I don't know if you want to share this, but we were talking earlier about the use of fish oil. And, we were talking about clinical trials and Black representation and underrepresentation and these treatments that are coming out that don't always one size fit all, right? And you mentioned you had a cool story about fish oil. because I remember you guys told me to get on this high grade fish oil, which cost me $90, by the way.
Sorry.
But you know, I buy it and I happily take it because you guys recommended it and I trust you guys. But you said that there was an article that came out about fish oil and its efficacy in cancer. But share with
So this was at, I'm also very active in Society of Integrative Oncology, which is, they have a lot of patient advocates involved in that too. And it's developing this whole field of integrative oncology. And they had a speaker last year who was giving an example of a study using fish oil for cardiovascular risk reduction. And in the population they chose, it didn't show a difference. It didn't show a benefit that fish oil made a difference. And so that got a lot of headline and a lot of publicity. But when you went and looked at the population, it was this like white male population that the study was done on. And they had I think it was a European background. Well, if you take that same study and put it on a minority group in America, they had a tremendous risk reduction. So it was a totally different population, but the one got the headline. And you have to have a diverse population that you're studying. You know, we've talked about some of the prognosis on certain cancers wasn't necessarily done on young patients. It was done on an older population. I've used the study. People have asked about, this might get us on a rabbit hole, but talking about like fasting. Well, a lot of the studies on fasting and exercise were done on young white college males. They have nothing in common with this old girl. And so how do you take that evidence and put it to the actual person and their characteristics?
You know, and I know Sarah should, you know, Sarah's ears must be going red with this because we talked about the Ebony trial that we're working on for this reason. You know, how do we get more minority representation in clinical trials? Because one of the things she was concerned for me, Sarah and I go back 30 years. So when I first got the diagnosis, in addition to having you guys, I also called her because I know she was working in this space. And one of the things, and I won't call any names, but we talked about this score that I had taken, this testing, and she wasn't very comfortable with it. But because my scoring was low enough, she breathed a little. But the point was that it wasn't tested on Black women, so that we're not, you know, the results may not necessarily be wonderful for me, but you know, we talk about the faith aspect. So
that score can also be altered by body weight.
Right.
Someone who's significantly obese might not be as accurate as somebody who's normal body weight too. So there's a lot of other variables in there. You're right.
Yeah. So so diversity, Black, white, also age, like you talked about,
right?
Old, young people, you know, now, you know, heavy body weight, lower body weight. I mean, we need more diversity in clinical trials, folks. All right. More questions, Doc. Hold on. So if you don't have access to an integrative oncologist, how do you recommend patients get this vital information? When we think of uninsured patients, it widens disparities.
Tremendously. That was one of the things that I've had to deal with in the past when developing an integrative oncology program is the cost and who's going to, you know, insurance doesn't cover a lot of these programs. We were blessed in some of the programs we developed that we had some philanthropy that we were able to provide these at no cost to patients. But I think that's a tremendous area in need in, you know, even the cost, like you said, the cost of a supplement.
Yeah.
You've now told somebody to go eat certainly healthy organic foods, which cost more. And now we're going to tell you to go take some more supplements. You know, it's hard. And talking about access too, one of the projects I'm working with now is developing possibly online services for folks to have integrative oncology services and survivorship services.
Yeah. Like I said, you know, my all of my visits with you guys were like this, you know, you guys asked me, hey, you look good. You look good today. I mean, you guys would say that. You guys would say, you look good today. I wouldn't know if you didn't tell me you had cancer. And, you know, and so that was good. But when you talk about even online services, Doc, and again, we're doing the best that we can. But here's the truth. In a lot of populations, so there is a digital divide.
Exactly.
Right?
Exactly.
So even with online, like, again, I'm a person with a computer and a phone.
Exactly.
There are people who don't have access, but you know, it's one step at a time. But when we bring out these proposed solutions, there's also a problem that needs to be addressed. So,
well, I always say that is the one thing that came out of COVID that had so much benefit, because prior to COVID, if I wanted to do a virtual visit, it had to be in a underserved area, Medicare area. I mean, it had so many restrictions you couldn't even do it.
Mm-hmm.
And the other thing that always surprised me is, if you had asked me before this pandemic, could I do and what I do, integrative medicine virtually, I would have told you, no, I don't think that'd work. I have to hug my patients. I got to really be in contact with them. And then I had a patient the other day who I saw him for the first time in person, and we realized we had never seen each other in person, but we felt like we had such a connection. And so,
Mm-hmm.
yes, virtual can make you do just as effective a job with integrative.
Absolutely. I've never met you in person. I came to your office, did a blood test, but never met in person. We met like this all the time. But I feel like I've known you all my cancer life, I've known you, which was a big impactful moment that you guys kind of got me through. So, I mean, yeah, I don't think it makes that big a difference. I mean, yes, there's something to say about a hug, but we can still get the ball rolling and keep moving with
Exactly.
virtual.
Exactly.
I
Exactly.
think Peter's question is similar to Sarah's question. How do you think we can make integrative oncology care more accessible to underserved and minority communities who may not have been told referred in their initial diagnosis? So I think that's what we're seeing, maybe
Right.
some virtual stuff that could work. And next question was, what has been your experience in terms of insurance coverage reimbursement for integrative oncology care?
That's good. And that's where, the research is needed, but sometimes it's hard to do research on an integrative modality. Someone knows if they get acupuncture or don't get acupuncture, massage, or some of these things, but the research is growing. Hopefully we can show that it's, more cost effective to have somebody doing an exercise nutrition program than end up putting all these medications for all these other illnesses that develop. The way you get insurance companies' attention is money, cost. So I think it's the area we just got to develop more of the effectiveness of what we're doing.
Yeah, yeah. So I remember this question was on one of the seminars.
I knew this one was coming.
I knew, right? Me too. This was on one of those webinars that you guys do. Do you recommend CBD, low dose THC in your practice?
So my joke about this is, if I had any business sense, my initials are CBD. I would be out there with Dr. CBD stuff. But I guess I don't have the good business sense. So we know that, CBD is a component of cannabis that doesn't have the neuropsychic. It doesn't make you high. It first came approved as a medication for seizures in children. Is probably one of the most growing areas of research. I've been part of the Canadian Consortium for the Investigation of Cannabidiols, who's looking at CBD. One area that, unfortunately, is not available in the U.S., there's a product that's a 1-to-1 CBD THC that's been shown to be helpful in neuropathy, but that product is not available in the U.S. It's available in Canada and Europe. So there are some roles for it. This is another thing too, is you got to know where you're getting the product from. Mm-hmm. Because people come in, they're taking something, we don't know what's truly in it, because it's not a regulated supplement. So I don't know what they're getting. We've had people taking something that just said CBD, and then they failed a drug test at work because it did have THC in it. So It's a very complex area. Going back in the history of THC is fascinating. I think there is a role for this. We just don't have some of the research is getting done in other countries. We can't do it here because of our cannabis laws. Mm-hmm. I think there is a role for it in symptom management with medicinal grade cannabis. We don't have that in a lot of the states. I mean, there's some research that was done at University of San Francisco. Here you have a product in low dose that could treat appetite, anxiety, and sleep with the side effect of relaxation. Wow. Okay. So I think this is an area that there's a role for it. We just haven't developed that role yet.
Wow. Doc, I know we're getting close to the end here. And I know you mentioned your own journey, right? Your own journey with being a 20-year survivor, right? So every time I look at you, I'm thinking to myself, yes, yes, that's what cancer patients do. They look to see who is surviving, because what you see on the media a lot of time is who's dying, right? Not just who's surviving. I don't know how much of that you want to share, but do you know what stage you were at and what kind of treatment? Okay.
I was 39 years old. I had 3 kids, 2, 4, and 7. Was at a very small town doc delivering babies, doing full spectrum medicine. Discovered a lump. Ended up diagnosed with stage 2 breast cancer. This was before we did chemo first. I went through surgery, chemotherapy, radiation therapy, and then hormonal therapy.
Mhm.
And for me, like I said, when I got to the end of treatment, I didn't want to go back through that again. So that's when I got involved in integrative medicine. That's when I changed my diet. I became enrolled in a study through Duke University at the time that looked at exercise and nutrition in breast and prostate cancer. The research always jokes that I became the outlier. That I took exercise to doing triathlons. I went complete all in with it. And that's really been a big part of my survivorship is exercise. I
Wow.
changed what was the role of stress in my life? What
Yeah.
was really important in life? How did I totally changed.
Yeah.
And then I was blessed to say, a lot of other survivors need to know this too.
Mhm.
And how can I share with other folks what I learned going through this process? You learn what's important, what's not important in life.
Yeah. And thank God you did. That's such a encouraging story because I am just now hearing about the role of, like, weightlifting and, that type of stuff. And I've picked it up, and I learned it on this show from a
Yeah.
guest.
There's a
And
lot of research now showing, like, for specifically breast cancer, the higher muscle mass you have, the fat mass, you're having better outcomes.
yeah, this is just great information. I think there is one more question. This may be a tough question to answer. Do you ever disagree with the oncologist? It sounds like your team is in sync. I know so many who have been treated for cancer and their oncologists won't even listen to questions about nutrition, CBD, or exercise, or even some of the other more natural approaches.
So when I first started where I was, the approach that I took was with the patients, letting them go back to their oncologist and tell them how effective it was for them, how, Dr. Bailey-Dorton didn't want me doing anything to interfere with my treatment, and how they were feeling better, or they got this good information. And then all of a sudden, anytime a patient would mention nutrition, supplement, CBD, or anything, they said, go see Bailey-Dorton. It just became an automatic, just we got her, go see her. We trust her, go see her. And I tell the oncologist, look, I'm here to help deal with all the other symptoms and side effects. You focus on the treatment. You focus on getting that patient to me so we can deal with them in survivorship. I'll take care
Mhm.
of everything else.
Yeah.
And
Working.
I think a big part too was coming in very conservative, very
Mhm.
evidence informed in the strategies that I do. I think the hardest patients I've had to that I've had referred to me are those who said, I don't want to do anything conventional. I just want to go do this alternative stuff. And if it doesn't work, I'll do conventional. And they send them to me. I'm like, there is
Right.
nothing out there. I know alternative that'll treat your cancer. There's things we can do integratively to help you get through the treatment with minimal side effects, recover, and decrease risk. But there have been studies that show if you go that route, you're 5 times more likely to die than if you go the other route with our help along the way.
That's worth people hearing. Again, I know people who are adamant about no conventional, only integrative, and you can't really say anything to some of these people because it's so personal. But I mean, here you're saying it as an integrative oncologist, like, listen, you're 5 times more likely to have an issue if you skip the conventional and just do integrative.
Right.
I mean, you gotta get that thing out. You gotta.
It's like you said, you always hear the stories of the bad outcomes and the bad side. The people that get through it and do okay and go on, you don't hear them because
You, you
they're
don't
doing
hear.
okay. Right.
Exactly. But I'm so glad when I met you. Doc, what are you, we talked about your transitioning from Atrium, from being full-time, from being a chief over there. And what are you doing? What is your next step so that we can, we just want to put it out there in case,
Well, I certainly, like I said, my sweet spot is working with patients, helping patients get control of their health, helping patients get through this. I'm working with some partners, develop some online programs that I'm not quite ready to put that out there yet, but develop some online survivorship and integrative programs. I'm getting ready to get board certified in lifestyle medicine. A lot of it, we
Mhm.
get somebody through cancer, we say, okay, we'll see you later, see you in 6 months, without giving them the tool to regain their health and become stronger for what they've been through.
Right.
Or you have a person diagnosed with cancer. Now you have 5 family members that are worried about cancer. What are we doing to decrease their risk?
That is so true. That is so true. Very true. Exciting stuff, right?
Yep.
Exciting stuff. Peter said, Peter is one of our team members. He's also a scientist. He says, please come and see us again on T-Talk.
Thank you, Peter.
Dr. Bailey, this was so fulfilling for me. You know, like I said, I got some more free information. It's my doctor's visit. It was so much better, and we'd love to have you back again.
Sure.
And we wish you great success in all that you're doing. We want to know what you're doing so we can also promote it.
I will make you be the first person I send back stuff where my next steps are.
Absolutely. Perfect. All right, guys, thank you for watching, and we will see you guys on Wednesday on the next T-Talk. Take care.